Data, they say, is life. Well, that's the phrase that has never been truer than now when the coronavirus is ravaging the world and forcing countries into a lockdown. There is so much that Nigeria can do with accurate data in stemming the spread of this pandemic. This can help in making life-saving decisions and direct resources at this critical time. But does Nigeria have this accurate data at this time to deal with this pandemic? Joining me via Skype is a business analyst and project consultant, Adekunle Adeniyi. Good morning. Thank you for joining us in TVC Breakfast.
Good morning. Thanks for having me.
All right. As a nation, we have had to deal with several public health issues. Talk about the Ebola, talk about HIV and AIDS, talk about, and even now, talk to us from your assessment in dealing with previous issues. What is your assessment of how we have infused the data at tackling all of these public health challenges?
I can say the use of data in terms of making decisions is still very, very low. Not only in Nigeria, I think in Africa in general. But I think Lagos State really have been doing something for the past 8 years now in order to capture data. I think they recognize the fact that they cannot plan, and without adequate data, absolutely majority of everything you are going to be doing is going to go into waste. Remember the saying of Peter Drucker that says that what gets measured gets done. So if you do not have a kind of a statistic in order to base all assumptions on, all scenarios on, then you are just groping in the dark. So data is the new currency, and a lot of even organizations, they understand the fact that I can penetrate to your need. And when I'm saying that your need, the power of data these days, I can even know what you are going to think in the next few years, next few seconds. So it's the ability for you to use big data in order to make a decision.
But
just to okay.
Go ahead.
Yeah, just to answer your question, yeah, we started a little bit late, but gradually, and you can see, majority of the decision that Lagos State is taking now is really based on the little data that we have at our disposal, so that whatever act that the government is working on is really based on fact, not assumption. Yeah, I know I've been discussing with a lot of people, maybe government should do this, government should do that. Well, most of the time you do not even understand the information that is at the hands of government. Most of what they are planning now is really based on the little data that we have. Yeah, we may not get everything perfect, but to a large extent, I think we are making some of the decisions now based on information.
But do you know that accessing data, especially from the health sector, is usually a challenge because of the policy of having to protect certain the interest or information about certain patients and all of that? How much of a challenge does this pose to having accurate data to tackle issues of this magnitude head on?
Oh, definitely. We know there is a Privacy Act that is not only in Nigeria, that is global. We have a lot of confidentiality in the way we handle data. But for planning, I do not even have to know you as an individual, but I can segment you in terms of demographic, in terms of your knowledge, in terms of your earning power, in order to make a lot of decisions. So in the health sector, I can say nearly, I think our public health and nearly good hospitals now, they are gradually converting their paper-based information into electronic information. And what that one is going to allow us to do is to process information faster. I saw earlier on your report that only 2,000 people have been tested in a population of 200 million people. That is one in every 100,000. So if we know the way these things have been ravaging the rest of the world, and we tested just one in every 100,000, So most of the time when I'm telling everybody to take this thing serious, it's like we still do not get it. It is still based on data that government is now projecting that, okay, if we've been able to test, let's say, so we are close to 200 people infected with this disease now. That is 1 out of every 10 that we've been able to test have been infected with the disease. So we can always do the manipulation. I'm not a politician. I'm just an analyst. I can help you convert challenges and issues into how you can now, what do you now do with this information that we have? So when you see government making a lot of decision, it is based on the little fact that so if we've tested 2,000 people and close to 200 people have the disease, so, and we do not have the capability to test every Nigerian. So Nigerians should understand that, look, what we are dealing with is beyond the kid's globe, and everybody has to come together in order for us to fight this pandemic. It's really, really serious.
All right, Adekunle Adeniyi, we'll leave the discussion here now. Thank you for speaking with us. You're watching TVC Breakfast. Data, they say, is life. Well, that's the phrase, that phrase rather has never been truer than now when the coronavirus is ravaging the world and forcing countries to a lockdown. There is so much that Nigeria can do with accurate data in stemming the spread of this pandemic. This can help in making life-saving decisions and direct resources at this critical time. But does Nigeria have this accurate data at this time to deal with this pandemic? Well, joining me via Skype is a business analyst and project consultant, Adekunle Adeniyi. Thank you for joining us on TVC Breakfast. Well, the consequences of COVID-19 is set to be grave and unsettling, especially with regards to the fatalities recorded so far. At the heart of this is how to complement or efforts to comprehend its impact, especially, and also forecast. And data is said to be very crucial with regards to understanding the direction to take with regards to making major decisions with regards to treatment at this time. Talk to us how important data is with regards to tackling issues like this, especially for a country like Nigeria.
Thank you very much. And just like I said in the earlier session, data now is live. And like I mentioned, without data, it's becoming impossible to plan. You remember that part of the reason why China was able to curtail this virus at the moment they discovered that, hey, what we are dealing with is beyond just the basic flu. Because they have the information, they know where you are, they know the people you must have had contact with. So they were able to make decisions fast. And they were able to make decisions fast because they are working with data. So it's very easy now to say that, okay, let's just lock down this particular area and now see how we can curtail it. And they have a lot of things working for their advantage, the ability to build intensive care units within a very short period of time. But like the Chinese proverb say that the best time to plant a tree is 20 years ago. The next best time is now. Like I mentioned in the earlier session, Lastra has been doing something so wonderful in Lagos State. You will discover that majority of what is happening now is because Lastra have Lagos State data. And I understand the fact that not many people have registered, but you know that at least over 40 to 50% of Lagos residents have registered. So when they are now planning to give palliative measure to those who are vulnerable, people are asking me, so how do we determine those who are vulnerable? We have the database. Now people say, but not everybody register. Now that is the importance of you getting involved on majority of all these government initiatives. It's not now that we are now running up and down that we now say, oh, I wish I could. It would have been, maybe you would have registered earlier. And we use that data in order to plan what we need to do in an environment like this. Nobody really envisaged this COVID-19. You will discover the rest of Nigeria, they will even want to come to Lagos. Why? Because Lagos is doing something remarkable. The additional beds, the additional structure that our governor is putting in place is based on data. We are already envisaging that, okay, like I mentioned earlier, that if we have, say, close to 200 confirmed cases, and we've just tested 2,000. Then something is really telling us that really the projection that the Minister of Health said to us that it will be close to 40,000 may be true. And we all need to follow what government. I know it's really, really tough. I'm not finding it easy. I can't remember the last time I sit down at home for even more than 8 hours. I'm getting restless. The kids are on my neck around the clock. But this is the sacrifice we need to make. It's a very bitter pill for us to swallow. But it is a sacrifice we all need to make.
Let me quickly interrupt your thoughts there, because earlier you mentioned how China was able to quickly address this as a result of its data bank. But some would say that developing countries like ours do not make budgets for things like this, especially when it comes to data analysis, having it shot up to the levels of developed countries like China's. So that is also a major challenge.
Just like when you have your new phone, you start putting information to it, and before you know what is happening, you use your phone seamlessly. We have to start from somewhere. Whether we are going to get to their level, it may take some years, but it's better than nothing. The little things that seems the magic that is happening in Lagos is just based on the data that I've been collecting for the past 6-7 years, and they are able now to do something with it. Imagine if we've been collecting data maybe for the past 50 years in this country, and the data is reliable. So, because I was involved in the project and I understand what we are using data now to do in these circumstances. If you register, we can predict. We know who are vulnerable. When people receive SMS that if we come and give you stuff at home, it's based on the fact that we know your age group, we know your sex, we know where you stay. All you need to do is to confirm. Then you don't have to go and queue somewhere and somebody will be handing out. In fact, that even makes you more vulnerable by going out. Now, we are taking the palliative measure directly into your house, which is something great. We can pinpoint everybody where they are. that is those who register. And that is the importance that if you do not register, then you are the one who is really hurting yourself. So the little data we have, that is what we are using. It could be better, I understand that, but we all understand. Even those who have prepared more than us, everybody is just trying everything. But like I think Paulosi said, that eventually we pray that we use science. And the data science now is very, very important. We have to use facts. We cannot be managing this kind of crisis just out of without having something to fall back on.
All right,
so please, if you still have, when everything gets back to normal, and we employ all Nigerians, actually those living in Lagos, please go and register with LASTRA. It takes you less than 10-15 minutes, and you'll be done. It helps government to plan. It reduces weight on government spending because we will be addressing specific needs and we'll be addressing specific requirements from that the social palliative that we are looking at now.
All right, we'll have to leave the discussion here now. Business analyst and project consultant Adekunle Adeniyi speaking with us on the importance of data there.